PQA Innovation Theaters are opportunities for PQA member organizations to showcase their innovations, technology services, and research in a very unique forum. This opportunity is your opportunity as an audience to learn more and ask more about these innovative solutions in the marketplace. We are thrilled to continue the 2020 Innovation Theater series with AssureCare. Our speaker today, Jim Gartner, is the Executive Vice President of Clinical and Product Strategy. Jim's passion is increasing access to clinical services provided by the pharmacist. He joins us today to discuss how the AssureCare platform is maximizing medication therapy management technology to extend the reach of the pharmacist. Jim, please tell us more.
Good afternoon, and thanks for the introduction, Lauren. So as introduced, I'm Jim Gartner, and as a pharmacist by background, I'm extremely passionate about the pharmacist providing quality services, quality clinical services, and being reimbursed for those services and the outcomes they achieve. It's time to move away from the PBM reimbursement model and start getting paid for the clinical services that are provided. While leader at CareSource, a large Medicaid managed care plan that had over 2 million lives, we successfully launched a medication management plan across all lines of business. The program showed a 2 to 5 to 4 to 1 return on investment, and we ran that since 2012. Today, I want to talk about how having the right technology can maximize the pharmacist's clinical services in even more ways than we were able to achieve at CareSource. So let's start here. The jumbled healthcare that we face today, the jumbled healthcare landscape. There's disparate parts. Pharmacy claims, medical claims are in different systems. They're not brought together. So we never really get a true picture of that patient. Quite honestly, the right hand doesn't know what the left hand is doing. Trying to keep track of projects on Excel, spreadsheets, and sending opportunities for clinicians to act upon via spreadsheets, and poor documentation. This is a lot to ask for the clinicians to be doing it this way. So let's figure out how we can bring that together. As a pharmacist in retail, health plan, and consulting, I have lived in all these worlds and have faced these challenges. Something has to change. How do we make that change? We disrupt with technology. So that brings me to AssureCare and MedCompass. We are passionate about serving the human lives that our platform can impact. I left a great job at CareSource because I know this platform can serve far beyond the 2 million lives that we served at CareSource and impact tens of millions of lives with AssureCare and the benefits of MedCompass. And MedCompass has the ability to bring all of the jumbled healthcare parts together. 3 characteristics that I want to point out of MedCompass make the magic happen. First, it's interoperable. Second, it's modular. And third, it's configurable. So that's great. What do those words mean? So interoperable means that MedCompass has the ability to bring all of those disparate parts together and can present the data with a Member 360 within MedCompass. And that Member 360 can be accessed like an electronic health record through the platform, through our provider portal, and our member portal. Modular. So in our system, we have different modules for population health, care management, utilization management, pharmacy management, appeals, and grievances. All these modules work together, and they bring all those disciplines of health care together. Now, a health plan doesn't want to have all those modules, or we're working with a pharmacy chain. They don't have to have all those modules. They can select who we can turn them off for them. But again, it's bringing all these pieces together in one platform. And additionally, with that, we are bringing program integrity, analytics, and all these portals together. Configurable. This is, to me, what makes the magic happen. There's role-based access based on securities. There's workflow automation. I can create a task and something will happen and it'll go to a clinician. There's case management flows and tools and client-branded communication and outreach. So if a patient has a HbA1c of 10, The system can automatically, when that lab data loads into the system, that lab data showing that it's 10 can automatically task to a dietitian to do a diabetic consult with that patient. It could task to a pharmacist to have another consultation with that patient and talk about their medications. So we can configure the system to drive those tasks to the appropriate clinicians. Along with those three components, MedCompass brings together multi-channel communications, emails, texts, faxing, and even virtual health or telehealth. A telehealth visit can be created or enabled by a pharmacist by sending a patient an email. In that email, the patient will click on a link and voila, there's a pharmacist face-to-face to talk to that patient. So I've talked a little bit about what our platform can do. Let me try to bring it to life for you. And I'm going to bring it to life to you with one of our patients, Roberto Hood, and show examples of how our ecosystem works without going into our platform itself. So Roberto is a Medicare recipient. I know he lives in an area of risk, high crime. He's in a food desert, high pollution. In fact, he lives in a county in Florida that has a very, very poor air quality. This begins to paint the picture of Roberto and the challenge he faces. We bring this in to light for the patient by bringing in and combining Roberto's information with the social determinants of health. From the social determinant of health, we also have information fed from HIEs and EMRs. I know Roberto's risk scores, such as his SDOH risk score, his case management risk score. Is he rising risk or is he a complex care patient? And I know his adherence risk score, so I know whether he's adherent to his medications or not. I also know within the system what authorizations he has. So within this system, we do utilization management, and we can do it on the pharmacy or medical side. Those utilization management reviews are documented in the system, so we know what's been approved and what's been denied. And from his completed assessments, we know what actions are in his care plan that are driving problems, goals, and interventions. Through this information, tasks are generated, tracked, and completed, and care plans are generated. For a pharmacist, we can generate an e-care plan. And yes, that e-care plan is certified by CPESN. And if we want to, if the physician wants that information, we could send it via FHIR standards to the PCP that is working with that member. All this information is captured in the Member 360, and the member can be engaged via web or portal pieces, and Roberto can complete a health risk assessment within the member portal. And the pharmacy team can complete a CMR and draw labs for HbA1c and then bill to a health plan. The system documents who's on the care team and all have security restrictions where needed to control what activities they can partake in. You can also see a picture of Alexa in there, and we can use Alexa to inform this patient when he has an appointment coming up, or he can use Alexa to talk to see if there's any things that need to be addressed, whether it be, he needs to get another HbA1c test done. So Alexa's there to help him along the way also. Now, let's explore additional capabilities as part of MedCompass. Our platform can support health plans and pharmacies. As you saw from a health plan side, we have extensive capabilities for care management and utilization management. But the magic truly happens because we bring pharmacy management into the mix with care management and utilization management. So a health plan, a pharmacy has a complete picture of that member. Today, I want to focus on the capabilities around medication management services. We are now bringing billing capabilities to the pharmacists that'll enable them to endeavor in new spaces. Most notably, as I mentioned, we have billing capabilities. So clinical services that are performed by the pharmacist can be billed to the health plan via our billing module. And if you need help with collections of that, we can do the collections for you for a small fee. Additional capabilities we bring to the pharmacy are pharmacogenetic connections, daily dose packaging, MTM encounters, CMR, TMR. So we bring the complete picture for MTM. We have e-care plan capabilities all built within the system. Telehealth, as I mentioned already. And then we have e-health integration. And for e-health integration, that allows the pharmacist to provide the member with information so they can select the right Medicare plan that works for them. And then we're also integrated with HealthWise, which will provide the pharmacy with much needed educational materials for that member. On the health plan side, we provide a complete medication therapy management system. And as you can see, we'll engage with a pharmacy network that meets the needs of your retail and matches the needs of your retail pharmacy network. If there's challenges with some pharmacies not participating in doing the medication therapy management encounters, we're glad to connect you with a call center that can complete those encounters for you. Our system is CMS compliant, and we have the reporting to meet your needs in case of for audits. And most importantly, interfacing with that pharmacy network will make sure that they're completing the needed encounters to make you a successful MTM program. All this, and you tie it together with all-in-one platform. Let me talk briefly about how we make this happen. We bring in member eligibility and can leverage pharmacy claims and, as desired, medical claims. The data runs through our series of algorithms, which I might add are tailored in many cases off of PQA measurement criteria and requirements. The encounters are generated, patient outreach is done, and then there's follow-up tasks that are followed through with. If there are any needs to bill, we have the ability to bill, and reporting is completed to meet CMS standards. So that's kind of the flow that we have for our medication management program. One last scenario I want to wrap up with is if we bring all this data together, so we bring pharmacy data, demographics data, consumer purchase data, we can identify appropriate opportunities for clinicians to act upon. In the case of Harry Sigaglu, we were able to capture pharmacy data and see that he needs to refer to a dietitian. We see that he's smoking because we have his consumer purchase data, and so we refer that to the pharmacist to help him get involved in a pharmacy stop smoking program. If he's successful in these nutrition programs, then we will make sure that he gets rewarded for that in the member portal. So these are just some of the things that we can do by taking the data that you provide us, identifying those opportunities, and rewarding the patient and helping them along their line of journey of providing great healthcare. I'm sure you're listening and wondering, you really do this all in one platform? The answer is truly yes. It is why I came to AssureCare. It is why seeing is believing, and I'd love the opportunity to have further conversations around the potential for MedCompass to have an impact with your organization and the patient and members you serve. Would anyone like to discuss how we can be impactful for your organization? Thank you.
Excellent. Thank you. I think we have a few pretty compelling questions. I think it's my own. There's a pretty compelling alignment between AssureCare's platform and the Roberto's story that you put out there. And I don't know about many folks in the audience, but your mention of Alexa set off my Alexa here in the house. So that integration is pretty awesome. So a few questions here from the audience. You mentioned that you can build them on the medical side. What codes are you using to do that?
So we use the standard codes, the 90,000 codes that are standard in the industry. And again, I think that is something that would evolve. And so those are time-based right now. So they're based upon how much time a pharmacist is involved. And so we've set up our system to use those. But I think, again, there'll be an evolution with those claims. We'll have to start working with CMS to see how we can, get more standard with them. We also have the ability to use SNOMED codes, but today we are using the traditional 90,000 codes.
Excellent. And then our final question here before handing it over to Jake. If we have pharmacies in your net, or rather, a question from the audience is saying, we have pharmacies that don't want to do MTM. What do you do counters in the technology here?
So we're so there's different scenarios that can play out with that. So number one, if the pharmacy does not want to do that, we can redirect those claims. And in most cases, we can redirect them to a call center pharmacy that will be able to do them. Another thing that we can do with those claims is redirect them to with a health plan. And having left CareSource and seeing how the system works, I think this is probably the ideal, is using some of your pharmacists in a health plan to act upon those encounters. And so we do have the ability to redirect them to the health plan or an external call center, as you wish.
Perfect. Well, Jim, thank you very, very much for joining us this afternoon and sharing more about AssureCare.